Hi, my name is Barzilay and I'm from Tel Aviv. In my profession, I'm a Chinese medicine therapist, but I started 20 years ago doing a PhD in cancer research. Then I worked for a pharmaceutical company for more than 10 years, and then I started studying Chinese medicine. Nowadays, I work as a therapist in a clinic in Tel Aviv, and I also teach research in Chinese medicine in a school in Israel and also abroad, today, this weekend in Finland. Um, I believe that research is one of our most important tools for advancing Chinese medicine and making it integrated into society and into all the establishments. I see it over the years where you look for Chinese medicine research and you can see how the level is improving and how much more impact it is making on the world. But more than anything, this year is a very important year for us because a lot of things has happened with Western medicine that has put some of the drugs that are being used in some areas um, in a really problematic area, and people are seeking, institutions, governments are seeking non-pharmacological interventions, of which acupuncture is one of them. I think that if you're interested in research, then your number one reference is the evidence-based project, which is a great project that was published at the beginning of this year, and that really reviews all more than 100 medical conditions and discusses the evidence in acupuncture for these conditions. And you can see that there's a lot of robust evidence for acupuncture in many therapeutical areas. On top of that, you have quite a few meta-analyses also created by the Cochrane institution, which is an institution that does meta-analysis for every drug and intervention. And for the last 2 years have been published some very positive results for acupuncture in the prevention of headache, in the prevention of migraines, also for the treatment of neck pain and lower back pain, as these are very useful tools for all of us as therapists to use in front of doctors. In addition, because of the issues with the use of narcotics or opioids and the use of non-steroidal drugs for the treatment of pain, there have been a lot of publications coming out from authorities, mainly in America, like the FDA, like the CDC, the Centers for Disease Control, and even the American College of Physicians, which is the body that recommends for all physicians how to treat their patients. And their recommendations are to seek non-pharmacological interventions, including acupuncture, as first, and then only go for the steroidal drugs, and then only go for opioids if they really feel that there's a need for that. So people are seeking other interventions that are not drugs, and we can offer to them. And part of it is because it's a real national crisis in many countries. So there's a lot of things that you can use in your market. Other evidence that was very useful that have come up in the last year or two is the use of acupuncture and Chinese medicine for supporting the recovery from cancer or for palliative use. And you have a lot of evidence for Chinese medicine in helping cancer-related fatigue, in the nausea and vomiting, in pain, of course, in hot flashes. So I really encourage you to try and look for research, either on the internet if you know how to and where to look for it, or just through some of the Facebook or groups that are available. Download the research and use it as real tool in your discussion. There is a lot of evidence, and using it can open door for discussions, especially from people who think that acupuncture is a holistic type of medicine and don't encourage the use of it or make fun of it, some of the skeptics. And you will discover a whole new wonderful world if you will review these. And I wish you good luck.